Welcome everyone. Today we're going to talk about one of the most debated diets on the internet right now, the carnivore diet, and what the science actually says about its effects on your heart. Whether you hear about it from social media, a friend, or you're already doing it yourself, this presentation is designed to give you clear, honest, evidence-based information. My name is Dr. Fernandez and this is the Grand Rounds presentation. Meaning, this is the kind of talk we give to physicians and healthcare professionals, but today we are making it accessible to everyone. Key points to emphasize. This is not about telling you what to eat, it's about giving you the facts so you can have an informed conversation with your doctor. The carnivore diet is growing fast. Millions of people are trying it. We need to understand it. Before we begin, I need to share a quick but important disclaimer. Please read along. Everything in this presentation is for educational purpose only. I'm sharing research and evidence. I'm not prescribing anything, diagnose anyone, or telling you to start or to stop any medications or diet. Medical guidelines change as new research comes out, so always verify information with your own doctor. The goal here is education. You're the expert on your own body. Your doctor is your partner in making decisions. Do not stop any medication based on this video. Always consult your personal physician before making major dietary changes. What is the carnivore diet? So what exactly is the carnivore diet? Simply put, you eat only animal foods. That means meat, fish, eggs, and sometimes dairy. You eliminate everything that comes from a plant. No fruits, no vegetable, no grains, no beans, no nuts. There are actually several versions of this diet. The standard version includes beef, chicken, pork, fish, eggs, and some cheese. The lion diet is the most extreme, just beef, salt, and water. The nose to tail approach adds organ, meat, and bone marrow for extra nutrients. Who is actually doing this? Mostly people trying to lose weight, people with autoimmune conditions like rheumatoid arthritis or IBD, athletes trying to change their body composition, and people with digestive issues like IBS who feel better removing plants. This is not a fringe diet anymore. Millions of people are doing it. The key defining feature, zero plant. That's what makes it so different from other low-carb diets. What are the claimed benefits? Proponents of the carnivore diet report several benefits, and to be fair, some of these are backed by real data. Weight loss, high-protein diet are very filling. Most people naturally eat fewer calories when they're eating mostly meat and eggs, and many do lose weight. Better blood sugar. When you eliminate carbohydrates, your blood sugar stops spiking. This is particularly meaningful for people with pre-diabetes or type 2 diabetes, who often see their A1C, their 3 months blood sugar average improve. Lower triglyceride. This is one of the most consistent findings across low-carb and carnivore studies. Triglycerides. The fat floating in your blood drops significantly. Higher HDL. HDL is your good cholesterol. It goes up on this diet, and the ratio of triglycerides to HDL, which is an important heart health marker, improves. Important caveat. Most of this data comes from short-term studies or self-reported surveys, not from large randomized controlled trials. We need more rigorous research. These benefits are real, but they're mostly short-term. We don't know what happens after 5, 10, or 20 years. Weight loss and better blood sugar are meaningful, but they're not the whole heart health picture. The cholesterol question, the big debate. This is where things get controversial, and this is the heart of the debate, no pun intended. When people go on the carnivore diet, several things happen to their cholesterol. LDL cholesterol, commonly called bad cholesterol, goes up, sometimes dramatically. Total cholesterol rises too. But not everything is negative. HDL, the good cholesterol, also goes up, and triglycerides go down. So you end up with a mixed picture. The most important markers here is ApoB, or apolipoprotein B. ApoB is the protein that coats every dangerous cholesterol particle in your body. Think of it as counting the actual number of bullets, not just the amount of gunpowder. ApoB goes up on the carnivore diet, and most cardiologists consider this is concerning. So, should you worry? The honest answer is it depends on who you are and what your full picture looks like. That's what the next few slides will explain. LDL going up is a concern. ApoB going up is a bigger concern. HDL rising and triglyceride falling are positive, but they don't cancel out elevated ApoB. Standard cholesterol panels may not tell the full story. Ask your doctor about ApoB. The lean hyperresponder, a special case. Here's where it gets really interesting. A subset of people on the carnivore diet develop an extreme cholesterol pattern that doesn't match anything we typically see in clinical practice. These individuals, usually lean, athletic people, develop LDL over 200, sometimes as high as 300 or 400. At the same time, their HDL is very high, often above 80, and their triglycerides are very low, under 70. Scientists call this the lean mass hyperresponder, or LMHR phenotype. Researchers proposed the lipid energy model, the idea that in lean, fat adapted people, the liver sends out more LDL particles to distribute fat as fuel throughout the body. In other words, the high LDL might be a reflection of how the body is using energy, not necessarily signs of artery damage. This is a fascinating hypothesis, but it's still a hypothesis. It has not been proven to mean these people are safe from heart disease. Lean mass hyperresponder is not a license to ignore high LDL. The full clinical picture, HDL, triglycerides, ApoB, prior plaque, all matter. If you are lean, athletic, and your LDL jump after starting this diet, discuss the lean mass hyperresponder phenotype specifically with your cardiologist. The keto CTA study, looking inside the arteries. Now let's look at real imaging data. What do the arteries of carnivore dieters actually look like on a CT scan? In 2024, researchers published the keto CT cross-sectional study in JACC Advances. They took 80 people who have been on carnivore or ketogenic diet for an average of almost 5 years. Most of these were lean mass hyperresponder individuals with a very high LDL, average around 272 milligrams per deciliter. They compared them to 80 matched individuals from the Miami Heart cohort, same age, same sex, similar risk factors, but normal LDL average 123. Both groups got coronary CT angiography, essentially a detailed picture of the coronary artery, plus a calcium score. The findings was reassuring. There was no significant difference in artery plaque between the two groups. High LDL did not predict more plaque in this population. This was a headline news in the low-carb community. But it's important to understand that this study can and cannot tell us. It is a snapshot. It doesn't tell us what happens over 20 years. This is a study is reassuring, but it's not a green light. Cross-sectional means one point in time. Plaque takes decades to build. This study followed people for around 5 years on average. It's a small study, 80 people, from a self-selected, motivated group. The follow-up study. What happens over 1 year? 1 year after the cross-sectional study, the same research group published a prospective follow-up in 2025, and this one raised more concern. They took 100 lean mass hyperresponding individuals and scanned their heart twice, once at the start and once 1 year later. They were specifically looking at non-calcified plaque, the soft, unstable kind that is most likely to rupture and cause a heart attack. What did they find? Soft plaque volume increases significantly over that 1 year. Here's the surprise part. ApoB, the bad particle count, did not predict who got more plaque. What predicted future plaque growth was how much plaque someone already had. The research called it plaque beget plaque. This is an important finding. It means that if you already have some plaque, even if you feel completely healthy, the carnivore diet may accelerate its growth. The major limitation: there was no control group. We don't know if plaque grew because of the diet or simply because everyone aged 1 year. That is a big gap. Soft plaque is dangerous plaque. This type of cause heart attacks when it ruptures. No control group is a critical limitation. We need a randomized trial. If you already have plaque in your arteries, this data is a serious warning sign. What traditional heart science says. Now let's step back and look at what traditional cardiovascular research has been telling us for decades, because the carnivore diet doesn't exist in a vacuum. First, TMAO. When your gut bacteria digest red meat, specifically the carnitine and choline in meat, they produce byproducts called trimethylamine and oxide, or TMAO. High levels of TMAO in the blood are independently linked to higher risks of heart attack, stroke, and blood clot formation. Second, ApoB and saturated fat. Decades of research show that saturated fat, which is very high in carnivore diet, raises LDL and ApoB. These particles get lodged in artery walls and trigger inflammation, eventually forming plaques. Third, no fiber. Plants are the food source of the healthy bacteria in your gut. Without fiber, those bacteria starve. The microbiome shifts in ways associated with higher systemic inflammation and worse heart outcomes. Fourth, no plant chemical. Polyphenols, antioxidants, and flavonoids from fruits and vegetables actively protect blood vessel wall. Studies consistently show these compounds reduce cardiovascular risk. The carnivore diet eliminates all of them. These are not opinions. These are based on large, well-replicated studies spanning decades. The absence of evidence of harm, short-term scan, is not the same as evidence of absence of harm. The carnivore diet removes nearly everything we know to be cardioprotective. Who needs to be extra careful? Let's talk about specific groups who need to be especially cautious. First, and most importantly, I want to share a real published case from Circulation in 2024. A 51-year-old man with a prior heart stent decided to stop his statin and start ketogenic diet. He developed the lean mass hyperresponder pattern, very high LDL, high HDL, low triglyceride. He felt great, but 2 years later, he had a major heart attack from a 95 to 99% blocked right coronary artery. This case is a reminder that feeling good is not the same as being safe. High risk people with existing heart disease or stent do not stop statin for a carnivore diet without direct physician oversight. This combination has documented harm. Familial hypercholesterolemia is another high risk. This is a genetic condition where LDL starts very high from birth. Adding diet-induced LDL elevation on top of genetic elevation is dangerous. Uncertain. Lean hyperresponding individuals. The cross-sectional data was reassuring, but the 1 year scan showed plaque growth. We generally don't know the long-term answer. Mixed. People with obesity or metabolic syndrome may benefit from weight loss and blood sugar control, but elevated ApoB and LDL requires monitoring. Never stop statin without talking to your cardiologist first. If you have a stent, bypass, graft, or history of heart attack, this is a high risk territory. Feeling healthy is not the same as having healthy arteries. What does the evidence say at a glance? Let's pull everything together in one summary table. Weight loss, the evidence says better with moderate confidence, very likely to help in the short term. Triglycerides, better with good confidence. This is one of the most consistent findings. HDL, good cholesterol, generally goes up, moderate confidence. LDL and ApoB, these go up consistently. This is the main concern. Blood sugar and A1C, better most people, especially those with diabetes. Artery plaque at baseline. One study showed it looks similar to people with normal cholesterol but low confidence, small sample. Artery plaque after 1 year. It grew. Also low confidence, no control group. Long-term heart outcomes, we simply don't know. No clinical trial assess. That last row is the most important. The carnivore diet has been popular for about a decade. We have zero randomized controlled trials with long-term heart outcomes. That is a massive evidence gap. Key points to emphasize. Short-term, mostly positive metabolic effects. Medium-term, plaque concerns emerging. Long-term, completely unknown. We are all, in a sense, in an uncontrolled experiment right now. 5 things to discuss with your doctor. Here are the 5 most important practical takeaway. Things you should actually do if you are considering or already on the carnivore diet. Number 1, tell your doctor if you're doing it. Don't hide it. Your doctor needs this information to interpret your lab results correctly. A sudden jump in LDL can look alarming without context. Number 2, ask for an ApoB test, not just LDL. A standard cholesterol panel measures LDL concentration, but ApoB measures the actual number of dangerous particles. In carnivore dieters, these two numbers can diverge significantly. ApoB gives a more complete picture. Number 3, do not stop your statin without discussing it with your doctor first. This is especially critical for anyone who established heart disease, prior heart attack, stroke, or stent. Statins save lives. The carnivore diet has not been proven to replace them. Number 4, understand that short-term results are not the same as long-term safety. You may feel amazing after 3 months. Your blood sugar may be better, your weight may be down. That is real and meaningful, but your artists work on a 10 to 20 year timeline. Number 5, this is not one size fits all diet. Context matters enormously. A lean, healthy 30-year-old with no risk factors is in a very different situation than a 55-year-old with diabetes and a family history of heart disease. A key points to emphasize. Get an ApoB test. This is the most actionable item on the list. Never stop statin without talking to your cardiologist. Your doctor is your partner, not your judge. The bottom line. Let's close with the bottom line. The carnivore diet has real, documented short-term metabolic benefit. Weight loss, better blood sugar, lower triglycerides, higher HDL. These are meaningful. But long-term heart safety remains generally unproven. We have one study showing artists look okay at baseline. We have another showing soft plaque grew at 1 year. We have no randomized control trial with 10 or 20 years outcome. There are legitimate scientific concerns, elevated ApoB, TMA production, loss of cardioprotective plant compounds, and early plaque progression data. The honest answer is we don't know yet. And when doctors say we don't know, that is not dismissal. That is an intellectual honesty. Talk to your cardiologist before starting or stopping any diet or medication. And if you're already on this diet, please don't stop talking to your doctor just because your numbers look different. Thank you for your time, and Remember, key points. Short-term benefits are real, long-term heart safety is unproven. This diet deserves more rigorous research, and so do you deserve to make decisions with complete information.